So we're going to talk about the basal ganglia, which are nuclei located in the telencephalon. They are located in the medulla of the cerebral cortex, and they are nuclei that are involved in modulating cortical activity, that are involved in motor function. So first I just want to get y'all oriented to certain coronal sections in the brain that cut through the basal ganglia. So most anterior in the brain, a coronal section looks kind of like a little jack-o'-lantern. You see the little eyes and then the smile. And then moving more posterior, you can see it still kind of looks like a jack-o'-lantern, except it's becoming a little bit uglier, I guess, with like maybe a little mustache on the jack-o'-lantern, and we'll talk about that structure in a moment. Moving back even further, it becomes to look sort of like beak-like, so it starts to look maybe like one of these birds from Angry Birds. Moving back even further, maybe it looks a little bit like these two aliens that are going head to head, like in Alien versus Predator, whatever. And then moving back even further, when you're getting more into the midbrain, maybe you could see a little elephant here with its tusk right there. So those are just to get you oriented. Remember that this is going anterior to posterior, and I stole most of these image ideas from Dr. Harrell. So when we're looking at this very anterior cut that looks kind of like the jack-o'-lantern, there are a few things that I'll point out. We know that this is the corpus callosum. We know these are the lateral ventricles. This is the septum pellucidum. And then in the lateral wall of the lateral ventricle, we have the caudate nucleus, which is a part of the basal ganglia. And then here we have the putamen. And these myelinated fibers located between the caudate and the putamen is the anterior limb of the internal capsule. And then where the caudate and the putamen come together in this region, this is called the nucleus accumbens. So the caudate and putamen both come from the same embryological structure, so together they make up the posterior striatum, whereas the nucleus accumbens is going to make up the anterior striatum, along with a couple of other structures that we'll see in a minute. So lateral to the putamen, the putamen is going to be bordered by this white matter that's going to be called the external capsule, and then there will be gray matter that's called the colostrum, and then bordering the colostrum is the extreme capsule, this other white matter, and then the next thing over will be the insula. And this will continue to border the putamen throughout the rest of the brain. Remember, we talked about how there's new data recently that's saying that the colostrum is involved in consciousness. Okay, so moving a little bit more posteriorly, we get to an area that still kind of looks a little bit like a jack-o'-lantern, except now you have this bar running through the middle of the jack-o'-lantern that looks like maybe a little mustache or something. And that bar is going to be called the anterior white commissure, and we've seen this on the mid-sagittal sections. So at this point, we still have our lateral ventricles, our caudate nucleus, and the lateral wall of the lateral ventricles. We still have our putamen, the external capsule, the colostrum, and then the extreme capsule, bordered by the insula. And we're starting to get a little bit more of our globus pallidus. And we'll divide that up into its individual components on the next image when you can see it better. But what's really important to see on this view, or of this cut, is this region here that's called the basal forebrain. And the basal forebrain is another part of the anterior striatum, so the nucleus accumbens, the basal forebrain, and some parts of the olfactory system make up the anterior striatum. So the anterior striatum is going to be involved in inputs from the limbic system that may influence motor function. So these are like emotional inputs. Okay, so moving more posteriorly in the brain, we get to a section that may look a little bit more like two angry birds looking towards one another. Like these are the beaks, this is the head, these are the eyes, if you can imagine. So in this region, you still have the lateral ventricles, you still have the caudate nucleus and the lateral walls of the lateral ventricles. You still have the putamen and the colostrum, the extreme capsule, the external capsule bordering the putamen, then the colostrum, and then the extreme capsule bordering the colostrum. You no longer have the basal forebrain, but you do have the thalamus and the hypothalamus down here. And when we're talking about the basal ganglia, we specifically care about the VA and the VL thalamus that interact with the basal ganglia. So at this point in the brain, we finally have a globus pallidus where you can see all of the structures. So this whole structure right here is the globus pallidus. And within the globus pallidus, there is an internal segment and an external segment. And we call these the GPI and GPE. The GPI and GPE are going to be separated by a thin sheet of axon fibers called the internal medullary lamina. And the GPE is going to be separated from the putamen via the lateral medullary lamina. And just to reiterate, the lateral medullary lamina will be bordered by the putamen. The putamen's lateral border will be the external capsule located here. The external capsule will be bordered by the colostrum, which is this gray matter located right here. And then the colostrum will be bordered by the extreme capsule located here. Okay, moving further posteriorly, we get to a level that looks a little bit more like the two aliens here, if you can imagine that. And at this point, we still have our caudate nucleus and the lateral wall of the lateral ventricle. There still is a putamen and the globus pallidus out here, although it's just a little bit shown here. We still have our thalamus located here, and we're starting to get into some structures that you haven't seen yet. So this structure right here is going to be the subthalamic nucleus. And then right here you can see the substantia nigra. So moving back to this last, most posterior cut, you can see an image that somewhat looks like a little bit of an elephant. You can see the trunk right there. On this slide, you can still see the substantia nigra located right here. You can still see some of the caudate nucleus located in the lateral wall of the lateral ventricle. And the other place that you can see the caudate nucleus is down here in this temporal horn of the lateral ventricle. And you can see it on this side as well. So you can see in this image that the caudate nucleus is this C-shaped structure that runs along with the lateral ventricle, and once it gets more into this temporal horn, it's going to form more of the roof of the lateral ventricle rather than the lateral wall of the lateral ventricle. I think the last thing worth pointing out is that once you get this posterior in the brain, there's not going to be any more globus pallidus or putamen. Okay, so now we're going to talk about some of the motor modulation that is performed by the basal ganglia. So the first thing that's important to know is that the thalamus is sort of the gateway for excitation of the cerebral cortex, or specifically the motor cortex. So it's sort of the gatekeeper, and anything that inhibits the thalamus is going to turn down motor output from the motor cortex. So the two main output nuclei of the basal ganglia are going to be the GPI and the substantia nigra pars reticulata. And both of these areas serve to inhibit the VA-VL thalamus. So they are tonically going to inhibit the VA-VL thalamus, turning motor activity down, which makes sense because we are not moving all of the time. So let's talk about the direct pathway, which is how the motor cortex can allow for movement. The left motor cortex will allow for movement on the right side of the body. So the motor cortex is going to excite neurons in the putamen, specifically D1 striatal neurons. And remember, the putamen is in the striatum. Then these striatal neurons will project to the GPI, which will inhibit the GPI. And when you inhibit the GPI, you take away some of the GPI's inhibition to the thalamus, which allows the thalamus to excite the cortex, which allows for movement on the opposite side of the body, because the corticospinal fibers will go down and decussate in the medulla. So again, remember, this is the direct pathway. Remember that the motor cortex is going to provide excitatory input to the D1 striatal neurons in the putamen, which are going to inhibit the GPI neurons, which is going to allow for disinhibition of the thalamus. Therefore, the thalamus is able to excite the motor cortex, which allows for corticospinal neurons to provide excitation on the contralateral side of the body. All right, so when I am showing the indirect pathway, we are going to start still showing the GPI and the substantia nigra pars reticulata, not to be confused with the compacta, providing inhibitory input to the thalamus, turning down excitatory output to the motor cortex. So the subthalamic nucleus provides excitatory output to the GPI, allowing for the GPI to continue inhibiting the thalamus to turn cortical activity down. However, the subthalamic nucleus is inhibited by the GPE. So the indirect pathway acts by the motor cortex, exciting striatal neurons that are D2 striatal neurons in the putamen. And then the putamen D2 neurons will act to inhibit the GPE neurons that are projecting to the subthalamic nucleus, resulting in disinhibition of the subthalamic nucleus, allowing it to excite the GPI, allowing the GPI to inhibit the thalamus. Therefore, the thalamus cannot excite the motor cortex. Therefore, you are turning motor activity down. So this is in contrast to the direct pathway that results in turning motor activity up. And it's important to remember that the basal ganglia are on the same side of the motor cortices that they respond to. However, they'll end up affecting the opposite side of the body, because obviously the cerebral cortex, motor cortex affects the opposite side of the body.